Hi everyone, welcome to today's session. Today we are going to study about third party reproduction in fertility. So this is an important concept in modern reproductive medicine, especially in ART based infertility management and all. So let's understand what it means, what options are available, and what are the ethical and legal considerations involved here. So let's move forward to the topic. Talking about the in definition, it is very simple. Any third party reproduction refers to reproduction where a third person provides gametes, embryos, or a uterus to help a couple to conceive. So any reproductive process where a third person contributes this gametes or uterus to help a couple conceive, this is called a third party reproduction. So this can include sperm donation, oocyte donation, embryo donation, or a surrogate who carries the pregnancy. So third party reproduction means using someone other than the intended parents to achieve pregnancy. So either it can be a donor, a gestational carrier, or both. So with the rise in infertility nowadays and age related decline and social acceptance, such methods are becoming very common now. So however, these techniques or these things involve major ethical and legal implications, especially under the Indian ART and the surrogacy law. So that is about the brief intro regarding our topic today. What are the indications? So when we can indicate this third party reproduction for facility. So when the male partner has a absent or severely abnormal sperm count, or carry a genetic disorder, donor insemination is indicated. So male infertility, like azoospermia, severe oligospermia and all, if there is any premature ovarian failure, or if there is any genetic disorders in one or both partners, or if there is any absence of uterus like congenital or acquired, or if there is recurrent IVF failure, in such cases we can indicate the third party reproduction facility. Okay, so now we'll see about the types of third party reproduction. One is donor insemination, that is sperm, and like donor egg or donor embryo or surrogacy. So each has a specific medical indications. For example, donor sperm in azoospermia, donor oocyte, that is oocyte donation in premature ovarian failure, and surrogacy in uterine abstinence. So these are the different types of third party reproduction. One is donor oocyte or the donor egg, embryo donation, that is donor embryo, and surrogacy, that is also two types of surrogacy: gestational surrogacy and traditional surrogacy. So that is what about the types of third party reproduction. So we'll discuss one by one regarding the types of third party reproduction. First one is donor insemination. So donor insemination is like we'll use or use of a donor sperm for insemination when the male partner, as I mentioned, when the male partner has infertility or any kind of genetic diseases, like it can be because of the abnormal sperm count or carries a genetic disorder. Then in such cases, donor insemination is indicated. Donor should be screened in such conditions. Donor should be screened for infections or any kind of genetic disorders, and it is also an option if repeated ICSI cycles fail due to poor sperm quality. So that in such cases we can do the donor insemination, and it is performed by the IVF or IUI. So that is all about the donor insemination. Next is the oocyte donation or the donor oocyte. So oocyte donation is used when the woman can't produce the viable eggs. Common examples are premature ovarian insufficiency, menopause, or after oophorectomy procedure, and all such condition you can do oocyte donation. Even older women with poor oocyte reserve this option, oocyte reserve, this option helps to achieve pregnancy using the her partner's sperm. So it is used when the female partner has ovarian failure or poor oocyte quality and the donor is hormonally stimulated. Oocytes are retrieved and fertilized with the husband's sperm. So that is what the process going on here. And the embryos, what will do? Embryos are transferred to the recipient's uterus. So this is how we will be doing the oocyte donation process. Next is the embryo donation. So embryo donation is how is useful when both partners are infertile. For instance, donate embryos from it is like in case of azoospermia in husband and ovarian failure in wife. That is an example. So in such conditions, embryo donation is okay, a good option. In such cases, embryos from another couple's IVF cycle are used. Transfer from the embryos from another couple's IVF are transferred into the recipient uterus. So it is useful in couples with both male and female factor infertility, and legally both gamete donors are anonymous here. So that is the process in embryo donation here. Next is the surrogacy. Surrogacy, as I mentioned, there is gestational surrogacy also, traditional surrogacy also. Gestational surrogacy, it is very important because like surrogacy, it involves a woman carry a pregnancy for another couple. Traditional surrogacy uses the surrogate's egg, while gestational surrogacy uses the couple's embryo. So when talking about the gestational surrogacy, the embryo formed from the intended parents' gamete is transferred to the surrogate uterus. So the couple's gamete is transferred to the person who is ready for surrogacy. In her uterus, we'll transfer this parents' gametes. So what will happen? The surrogate carries the pregnancy but has no genetic link to the child. It is commonly used when the uterus is absent or pregnancy is contraindicated. In such cases, we can do this gestational surrogacy. So in India, only altruistic gestational surrogacy is allowed under the 2021 Surrogacy Regulation Act. So you have to know about these things. So this is the gestational surrogacy. This is what happens in the gestational surrogacy process. Next is the traditional surrogacy. In traditional surrogacy, what happens is surrogate is inseminated with intended father's sperm. Surrogate is so it like we will be taking the father's sperm and it is inseminated into the surrogate. So surrogate is a genetic mother of the baby. It is very rarely practiced due to the ethical and legal issues. So when a woman doesn't have a uterus, like after hysterectomy or congenital absence or severe intrauterine adhesion, surrogacy may be the only option. Also, it is the surrogacy is considered in the recurrent miscarriages or repeated IVF failures. On such conditions, we will do surrogacy, both gestation and traditional. But gestation is okay, but traditional is not practiced nowadays. It is due to the ethical and legal issues because while comparing to the gestational surrogacy, the surrogate mother doesn't have any genetic link to the baby. It is from the both the parents' gametes. But in traditional surrogacy, in the among the couples, the mother does not have any link to the baby. The father's sperm is directly inseminated in the surrogate mother, and the surrogate person is the genetic mother of the baby. So that is how the traditional surrogacy and gestational surrogacy works. So that is about the surrogacy part. Now, before doing such things or such protocols, such or donations, we have to do a certain protocol for screening and selection. So donor must be medically and psychologically fit. The age should be 21 to 35 years. they are screened for any infectious diseases as genetic disorder, like screening for HIV, hepatitis B or C or syphilis, and also such conditions we will be doing screening process. And the psychological evaluation is also done. And age range from for oocyte donors generally from 21 to 35 years, as fertility and oocyte quality decline after that. And informed consent is very important, is very mandatory in such screening. So these are the what a donor screening protocol we will be doing before processing into the other procedures. Next is the recipient evaluation. So recipient screening, how we'll do the recipient evaluation. So recipient couple must also undergo screening, particularly uterine evaluation. Detailed infertility workup will be done. Uterine cavity assessment is done. Hormone profile, hormone preparation to synchronize the endometrium with embryo transfer. And it is equally important is counseling regarding the genetic, ethical, and emotional aspect. Psychological counseling is also very important, and consent from both the partners. So these are the recipient evaluation we'll be doing. So donor evaluation, donor screening is also important, as well as the recipient screening is also very important before further moving on to the next treatment protocols. Now talking about the legal and ethical considerations. So, legal and ethical considerations. India has a strict laws. It commercially surrogacy is banned. Only altruistic surrogacy is permitted. It is governed by the ART Regulation Act 2021 in India. Anonymous gamete donation is allowed. Commercial surrogacy is banned. Only altruistic surrogacy is permitted. And the laws protect returned informed consent essential for all the parties. So consent form is very important from the donor side as well as the recipient side. So these laws protect both the donor and recipient rights, so that is very important. When so these are the legal aspects in India. So these have to be followed when you are doing when you are processing such surrogacy or donation and all. So these have to be followed before further proceeding any kind of procedure. So that's about the legal and ethical considerations. Next is the counseling and consent. So this is one of the most sensitive aspect here. So mandatory counseling is important for it, and for all involved, mandatory counseling is very important. The couple, the donor, and surrogate must undergo counseling. Informed consent is essential. Discuss about the emotional, social, legal implications about this procedures. Confidentiality should be maintained, must be maintained, and future disclosure to the child should be handled ethically. So that is like when you're planning for such procedures, you have to go legally, and as well as you should be considering the emotional aspect and social legal aspects of the things. So consent form signed before procedure is very mandatory, very important. So these are the counseling and consent things you have to do for such procedures. Talking about the success rates. So success rates, donor oocyte or oocyte donation IVF, 50 to 60% is have a good success rate. And the success rates depend mainly on the embryo quality and recipient uterine receptivity. So donor oocyte and surrogacy cycles have higher success rate compared to the self egg IVF in older women. So it depends on the age, embryo quality, and uterine receptivity and all. So that's about the success rate. Talking about the complications, like any ART, artificial reproductive technique procedure, complication exists. So the donor may develop ovarian hyperstimulation syndrome, multiple pregnancy. Recipients may face multiple pregnancy risk. Psychological and legal issues must always be addressed beforehand. and transmission of infections. If screening is inadequate, then these are the most common complications you will be finding in the procedures or the treatment time. Next is the management. OPD management. In the OPD, we start with the detailed counseling. We explain the procedures, collect the informed consent, screen both the donor and recipient for the procedure, and complete all the legal documentation. This step is very crucial before proceeding to any artificial reproductive technique centers. So, initial infertility evaluation is important, counseling about the third party options, donor or surrogate selections, and documentation is important. Baseline investigations and legal consents are done in the OPD. Scheduling, stimulation, or transfer cycle is done. So, these are the things you will be doing in the OPD or as an outpatient procedure. Moving on to the IPD management. In the hospital setting, oocyte retrieval and embryo transfer take place under controlled environment. The recipient receives the luteal support, usually progesterone. Donor is monitored for any post-procedure complications like pain or OHS and all. So, donor ovarian stimulation and oocyte retrieval is done in the IPD. IVF and embryo transfer procedures are done in the IPD, and surrogate monitoring should be done, and pregnancy monitoring and delivery plan should be done accordingly. So these are the IPD management inpatient things you have to do during this procedure time. Next is the follow up and psychological support. So follow up is very essential. Early pregnancy ultrasound confirms the implantation. Psychological support continue should be continued throughout the pregnancy and post delivery. And legal birth registration process, legal steps ensures both the proper parentage transfer under the Indian laws. So all these things are very important. Monitor for any emotional stress, and support not only to surrogate for but both the donors and surrogates post procedure is required. So that is the follow up and psychological support you should be giving to the patient. So that's about today's session about third party reproduction. To summarize today's lecture, third party reproduction provides a hope for couples with irreversible infertility. However, there are so many medical, legal, and ethical dimensions which are tightly interwoven. So, we have discussed what is the definition and what are the different types of third party reproduction. We like donor embryo, oocyte embryo donation, egg donation, sperm donation, and gestational and traditional surrogacy. And if we have seen all the different types of third party reproduction, and we have also discussed the indications in what are the different in what are in different types of donation, what are the things we are doing, and how we can, and what are the legal and ethical aspects while doing these procedures, and what are the follow-up and psychological supports we have to give to the patient, or not only the couples and even the surrogates and as well as the donors also, and how and what and all procedures you have to do as a doctor in the OPD basis and as well as the IPD basis, and what are the follow-up post-operative cares you have to do. So third party reproduction is when ethically, legally practiced, can bring a good success rates. So it should be always it should follow always follow legal ethical things and maintain confidentiality regarding the process. So our role is to ensure safety, transparency, and compassion in every such cases. So that's what important when you're planning for a when the couples planning for any third party reproduction techniques or artificial reproductive techniques. So that's it for today's session. I hope you understood about third party reproduction and about their legal aspects and ethical aspects, and especially in India, what are all the procedures we have to follow. So that's it. Thank you so much for patient listening and have a nice day. Thank you.